Hi, everyone. I'm Dr. Lisa Palmer, Dr. Mama Bear, coming to you live from Central Florida on full moons, female health, and fantastic practitioners. What is the deal about full moons? What is going on with full moons? This Friday is a full moon and supposedly a eclipse. I used to think as a holistic physician that who cares about eclipses or solar flares or other planets or full moons or new moons or half moons or any of that. Because what does that have to do with health? I thought it had nothing to do with health. If you talk to emergency room personnel, they will tell you that something happens during full moons, and medical doctors and nurses and hospital administrators will tell you they have increased cases during full moons. What is the link between full moons and health? What happens? From a environmental standpoint, during a full moon, tides will change. So ocean rises, ocean falls. The moon seems to have an effect on the rest of what's going on in the planet. And ER staff will tell you they have increased people coming into the emergency room with issues. Parasites can occur in the human body. Malaria is caused by a parasite. Filariasis is caused by a parasite. Amoebas are parasites. Different digestive issues, Giardia is parasite. And these things can cause negative effects in the body. Many of these parasites are made of high levels of fluid, of water. And just like the tides, which are water, right? Water based can be affected by moons. It seems like the moons can also affect parasites, causing potential teeth grinding, nightmares, cravings for sugar, digestive issues, nausea, vomiting, skin rashes, bloating, gas, you name it. Parasites can go into that area and cause symptoms. How do you get parasites? Where do they come from? You can inhale them. They can be airborne. They can be in the air that we breathe. They can be in our water supply. Chlorine does not kill certain parasites. You can get them from swimming in pools, eating sushi, playing with your pets, walking barefoot. There's parasites that will go into the bottom of your feet and crawl through your bloodstream and eat your red blood cells, causing anemia and fatigue. They are nasty, nasty creatures. And one of the most common things that we work on in our office here in Central Florida. Why do I think we work on it a lot? Well, at Palmer Natural Health, which is the office that my husband and I own, we tend to get patient cases where other practitioners, other medical doctors, other healthcare staff have trouble with. And it's not because they're bad practitioners, it's just that they're sneaky, parasites, you might be able to find it in a blood smear. So, like in a malaria case, you possibly can find it in a blood smear. But think about it, you have pints of blood going through your body. You take one little drop. So the technician that's doing this test takes one little drop out, puts it on the slide, smears it, and they're looking for eggs or looking for parasites in one little drop. But there's many, many drops. It's like trying to find a parasite in an ocean, right? Like that would be pretty hard with one drop of water or one drop of blood. So it gets missed in the blood. You could do a fecal test where, not to be disgusting, but they take a log of poop, they scoop a little bit of the poop, they stick it under the slide, and they look for eggs or look for parasites. That misses it. The parasites may not be coming out in the poop, right? Because the parasites could be in your eyes, could be in your brain, could be in your heart, could be in your digestive tract. And if you're not killing the parasite, there's no reason for it to come out in your poop. So very, very oftenly missed in the poop. We could look at blood antibodies and antigens in the blood. Again, may be missed. Those tests may miss them. You could look for high white blood cell action. Again, could be missed. Unfortunately, a lot of these cases are suffering, and because it's not clear on their diagnosis, they're diagnosed with anxiety. They're diagnosed with depression. No one's ever came to my office saying, "Yay, I feel horrible." That would be pretty crazy, right? That'd be pretty crazy. Usually if you feel bad, you're not going to be happy about it. You're going to be sad. Unfortunately, these people are getting diagnosed with depression. There's a cause to depression, right? It has a cause. Parasites can eat the neurotransmitters in the brain, make you feel sad, make you feel anxious, make you feel apathetic, like who cares, right? Everything has a cause. And what we do is we use quantum nutrition technology to look for the cause. Is it the frequency of parasites? Is it potential chemical toxicity, metal toxicity, mold illness? What is the cause? If we can identify the cause, then we can look for different homeopathy. We can look for different nutrition. We can look for different carbon technology to help not cure or treat, but help to rebalance the body to get the body to heal itself. If we switch to the subject of female health, there are reasons why female hormones go out of balance. Chemicals in your environment can cause female hormones to go out of balance. So if you have a lot of chemical exposure from aerosols in the air, like any kind of perfumes or scented aerosols, you inhale that, your liver is going to have to break that down. You put chemicals, you touch chemicals, like you're cleaning something with bleach wipes, your body will absorb that if you have bare hands and not gloves. If you put certain lotions or makeup on, your body can absorb those toxins, and then your liver is going to have to break down those toxins. Pollution in our water supply, pollution in our food supply. Our food, even if you're eating organic does not mean no chemicals. Organic needs less chemicals. If you're growing your own produce, great. But unfortunately, our atmosphere is also polluted. There's fallout that comes from rain, and you still can have that produce exposed to different chemicals. And I'm not saying this in a way to be depressed. I'm saying this, and this is the reality of what we're dealing with. The water you're watering your plants with is polluted. If you have high levels of toxins, which I would be bold enough to say many women do, the liver will not break down hormones properly. If you have excess estrogen in your system, that can lead to imbalances in your female cycle, causing premenstrual syndrome, causing menopausal symptoms like hot flashes, dryness, low libido, causes imbalances in your female endocrine system, leading to symptoms. The medical treatment for that is to give you whatever hormone you're not having a lot of, to give you more of that. And then, unfortunately, if you're given a hormone, it is a chemical, and it will cause imbalance in your other hormones. If you take estrogen, it imbalances other hormones. If you take progesterone, you actually make less progesterone, and it imbalances other hormones. I had a female patient, she was taking testosterone, and for whatever reason, her medical doctor was giving her high levels of testosterone. Now, this lady is really sweet. And so when she came in, she was kind of irritable. And she's like, well, Dr. Palmer, blah, 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 blah. And I don't like my coworker. And I didn't like this person on the road. And I didn't like this. And I didn't like that. And, rah, rah, rah. And she was kind of aggressive and irritable. And then I was testing her with quantum nutrition testing, and I was finding imbalances in her endocrine system. She brought into me her most recent blood work, and I found her testosterone levels were over the high range. They were out of high range. They were crazy high. And I looked at her blood work and I was like rubbing my eyes like, am I reading this right? And I was like, do you see how high your testosterone levels are? She's like, oh no, my doctor didn't mention that. I'm like, look how high this is. This is crazy. I go, no wonder why you want to fight everyone. And then everybody aggravates you and you're mad at everything. Your testosterone levels are way too high. So please talk to your other doctor and let them know that, this blood work's reflecting high testosterone levels, and you need to talk to them about decreasing your testosterone. And she's like, oh my gosh, that makes so much sense, right? Hi, Robin. Hi, Jonathan. Hi, Tati. Jonathan says, don't forget to eat less carbs on Cinco de Mayo. Yep. So the 5th of May is in 3 days. People tend to celebrate by eating lots of Mexican food. And yes, Mexican food is high in corn, high in wheat tortillas, high in carbs. Churros, fried dough, is high in carbs, and that can really irritate parasites. Parasites love carbohydrates. And when you consume extra carbohydrates, they will be more active and you will be more miserable. So if there is imbalances in female hormones, we look for what is imbalancing it, finding the cause, fixing the cause, and then hormones will balance themselves. And what's crazy is I have these fantastic practitioners in my office. My associate practitioners are awesome. I'm so honored and so blessed to have them as part of the team. They're getting amazing results with everything from helping patients with ocular migraines to irritable bowel syndrome to respiratory issues to whatever, doing such an amazing job. I had the pleasure of being in Des Moines, Iowa this past weekend, teaching a packed house of practitioners, everything from holistic vets to doctors of chiropractic to acupuncturists. We had a farmer who wants to apply quantum nutrition testing to his livestock, to his grass-fed, pasture-raised, wild, I don't want to say wild, but grass-fed livestock, and apply it to his plants. I'm like, that is the coolest thing ever. And so I encourage you, if you need help, if you are suffering from female health issues, if you have the worst PMS that your husband wants to run and hide, and your kids are like, oh, it's mom's time of the month. If you have awful migraines, which you have to hide in a dark room and not talk to anybody, if you're exhausted every day, if you're squirting water out your butt, if you have the itchiest rash ever and you want to rip off all your skin, please, please, please reach out to us at Palmer Natural Health. Sarah Allo's on here. She's an amazing practitioner. Reach out to her in Des Moines, Iowa. She also has an office in New Jersey and South Carolina. Reach out to us and we are happy to help you. You do not have to suffer. You do not have to take more medication. You do not have to take more hormones, right? So if I'm not your physician, I'm not advising you to stop any medication. I am definitely not advising you to stop your hormones. I'm not saying that. What I am saying is you can keep piling on medications and hormones, or another option could be, let's look to see if through quantum nutrition testing, we can identify the cause of the imbalances in your body, find out why you're having these symptoms, help your body rebalance itself. And then the most amazing, fantastic thing happens is the body heals, right? If you cut your finger, you don't have to say, okay, body, yeah, send some immune system there to fight off whatever bacteria is in there. And oh, by the way, send some clotting factor so I don't bleed to death. And oh, yeah, I maybe should repair the skin. And if I nicked a blood vessel, go ahead and repair it. You don't have to say that. Could you imagine how exhausting that would be? Your body knows how to heal itself. It's not the Band-Aid. It's not the Neosporin. It's not any of that stuff. The body heals itself when it's free of any kind of toxins and interference. If there's a high toxic load from chemicals in the air we breathe, chemicals or metals in the water that we drink, impurities in the food that we eat, then your body will have more difficulty in healing. And then you end up with symptoms. If those symptoms, if we don't find the cause of the problems, then the symptoms lead to a diagnosable disease. And then you are given whatever medication fits those set of symptoms. Every single medication out there, every single one has a side effect. Children's Tylenol has a side effect. Ibuprofen has a side effect. Side effects is really what I should be saying. Aspirin has side effects. If you don't believe me, look at drugs.com, look up these medications and see they have side effects. Why? Because they're all chemical and metal based. They all have negative effects. They will never fix the cause of the problems. They're suppressing the symptoms so you feel better. You don't feel the pain, but you want to have your body identify pain. If I stick my hand on a hot stove, I don't want to take ibuprofen or hydrocodone to block the pain. I want to take my freaking hand off the hot stove, right? I want those pain receptors in my hand to say, hey, this is too hot. Move your hand. Diabetics lose sense of their nerves. It's called neuropathy, and they can stand on a nail. The nail can go through the bottom of their foot, and their nerve is so damaged from high blood sugar, from irregular blood sugar levels, that they won't even feel the nail. That is horrible. That's what happens when you lose the sensory system in your body. That's what happens when you have so much imbalance in the body that the body is in a state of not healing, right? There's amazing, fantastic practitioners out there. reach out to us. We can help you and we'd be happy to help you. I feel like health detectives, and I'm sure a lot of my colleagues on here too, they feel like health detectives. We look for the mystery, we look for the cause, we put together a personalized program based on the body rebalancing out itself, and amazing things happen. I'm Dr. Lisa Palmer, Dr. Mama Bear. If you need our help, I'm happy to help you. We will be fantastic in finding the cause, handling the cause of your problems, putting together a personal program, and holding your hand through the process. Good night, everyone. Bye.